Now I'm doing her urine sample. I'm doing Miss Murphy's urine sample, and we need the stick. This is going to check for diabetes, liver function, ketones usually associated with diabetes. This is going to tell me whether there's any blood in her urine, which we interpret mostly as being an infection. This is going to tell me the pH, and this is going to tell me the protein level. So we only need a couple of dots. I'm being careful not to touch the stick, so that if I decide I want to go after a sterile urine sample for the purposes of culture and sensitivity, this sample will be fine. It's still sterile. If I want to use this, I'm being very careful with this urine sample so that it's staying sterile, and that way if I decide that I want to do a culture and sensitivity on it, the sample's sterile and it's suitable. So we're now tapping we lift the stick and tap it vertically to get the excess off, and now we just wait. In the meantime, while waiting for the appropriate length of time, according to the timing on the side of the bottle, we can wait for that, and in the meanwhile I put the urine again in a sterile fashion onto the refractometer, and the reading method is exactly the same. It's just read against a different scale, and her urine specific gravity is actually 1022, which is a slight improvement over the last year. So the treatments that she's been on have been, quite good, because we fiddled about with her diet a little bit.
Yes.
So she's obviously getting a bit more. Protein sticking to her.
Oh, good. So shall I keep on with the
I think
food?
so.
Okay.
Yep, because they will eat more of what they enjoy.
Yes.
And
yes.
as I said, at this stage, it's all about calories.
Yeah.
So we put that aside, and back we come to checking the rest of the urine. She's not diabetic. This has stayed blue. The liver's okay at this stage. These two pads only pick up very severe liver problems. She's not got ketones. She's actually not even got an infection in her kidneys. There's no little green dots on this one, so that's really good. The pH is down at 5.0 or 5.5, which means that metabolically her kidneys, she is in full kidney, compensated renal. Well, they call it compensated renal failure, but it's compensated renal insufficiently. Okay. As one of my friends said, it's only failure when you're dead.
Right.
So she's managing quite well.